The Centers for Disease Control and Prevention say it's safe for fully vaccinated people to travel, although they still advise against non-essential trips.
For domestic travel, fully vaccinated people do not need to get a COVID-19 test before or after travel and do not need to self-quarantine after travel. For example, fully vaccinated grandparents can fly to visit their healthy grandkids without getting a COVID-19 test or self-quarantining.
But will the latest surge in COVID-19 cases around the world scuttle summer vacations, especially overseas? Joining us with more are Dr. Robert Murphy, director of the Institute for Global Health at Northwestern University's Feinberg School of Medicine, Claire Bushy, a Chicago-based reporter covering the airline industry for the Financial Times, and John Conena, president of Venus Travel, a travel agency on Chicago's northwest side. Welcome all of you back to Chicago tonight. I want to start with you, Dr. Murphy. Do you agree with the new CDC guidelines in that it is safe for folks who are fully vaccinated to travel without getting tested?
Oh, absolutely. The vaccines that we have out there today, the 3 that are approved right now in the United States, are incredibly effective. Way more than originally anticipated. And hey, take advantage of it. You're 90 to 95% protected.
So no need to get the test before coming back into the country or traveling domestically before coming back. Claire Bushy, let's take a look at the air travel data. TSA has tracked about 1.5 million travelers yesterday, way up from the 120,000 number from a year ago that day. Still down 1 million passengers from 2019. How's the airline industry feel about these numbers?
Well, the chief executives of the large U.S. carriers are overjoyed that things are improving because, as you point out, they're better than they were a year ago. They are still radically bad if you want to compare them to 2 years ago. But some improvement is better than none. It's primarily been in leisure travel, though, and that's a bit of a concern for Chicago's airline, United, because much of their money comes from business class travel.
So business travel still lagging. John Conena, what about from your vantage point as a travel agency? How are bookings doing, and are there places that are better than others? Domestic, Mexico, Europe?
Yeah, we're right at the moment. Paris, Mexico has been a hot commodity, especially during these spring break days. And of course, Florida has been unbelievable with fares under $100 on any carrier. But the market that needs to improve, and I don't see it improving, is the European market, just because of this situation with the vaccination that Dr. Murphy had mentioned.
And there's a surge in several European countries right now. Dr. Murphy,
yes,
we're seeing
exactly.
a surge in this country as well. Is increased air travel contributing to that surge, Dr. Murphy?
Any movement of people that are potentially infected is bad for the epidemic, for the pandemic. So, as you can see from these guidelines, yes, it's safer to go. You don't have as many requirements if you're vaccinated. But the recommendation is still put off the travel if you can put it off.
And it still seems like it's business travelers that are still putting that off, not so much leisure travelers. Claire Bushy, we talked about vaccine passports in an earlier segment on the show. Curious, what are airline stances on vaccine passports or proof of vaccination?
The airlines are in favor of anything that helps reopen travel lanes because in particular, traveling to Europe continues to still be down, and transatlantic travel is a huge moneymaker for the airlines. So they are in favor of anything and everything that gets more people in seats flying.
Might airlines require a vaccine, having had your vaccine or being fully vaccinated?
Well, right now there's not enough people that are vaccinated. That's the problem.
Do you think, but at some point when vaccination rates go up, that airlines might require that?
Oh, absolutely.
And you think that would, obviously you think that would be a good move. John, what about demand for summer travel? Summer is such a busy season for airlines, especially for leisure travel. Do you anticipate travel picking up over the summer as vaccination rates improve here, or could the situation in Europe scuttle that as well?
Well, I really do see it getting better because of the little bit of what happened here in the spring. But again, if I'm going to continue to harp on this European thing, like Dr. Murphy and Claire have said, the Europe situation becomes very critical just because places like France, Italy, Spain, Greece are having their issues with the vaccine. Either they don't have enough or they can't distribute it to the people like we are doing here in the U.S.
And Dr. Murphy, when do you expect the rates of vaccination to catch up with the surge in cases that we've seen over the last few weeks and maybe start to bend that curve dramatically?
Well, that's the race that's going on right now. Here in Illinois, we're vaccinating over 100,000 people a day. I mean, this is an incredible pace. We're doing actually pretty well. And in the next 3 months, you're going to have the vast majority of people that want to take a vaccine are going to be able to have had it.
And that's certainly going to speed up. If it's a tortoise and a hare here, the hare might start to speed up here, the hare being vaccination. Claire Bushy, how long can airlines survive financially without robust international travel, without robust business travel?
Oh, that's a good question. Generally speaking, the 4 major U.S. carriers are largely considered to be out of the danger zone in terms of filing for bankruptcy, but they do have large amounts of debt. American Airlines in particular has a very large amount of debt because they bought a new fleet essentially right before the pandemic made the bottom fell out of the market. So it will be a long time before the airlines are able to fully recover financially from the pandemic, even with all the taxpayer support that they've received over the last year.
I was going to say a lot of money coming in from some of those government loans. John Canena, same question in terms of the travel agency industry. How long can companies like yours go forward without more robust international travel, without more robust leisure travel?
Well, I have to tell you that European market, and especially for the agency that I've had, that is a market that basically is the profitable side of my business. And if it doesn't pick up, it's going to be a problem. I mean, another year of this, I don't know how Europe, we'll forget about the airlines for 2 seconds, how Europe is surviving without the tourism. Europe needs the tourism. And this really becomes a huge issue. But I'm going to agree with Claire. Sometimes these airlines are getting out of the danger zone of the bankruptcy, whatever, how the government is handling or what. But the major 4 seem to always have a way to get out of this. But we need a lot of help, that's for sure.
Dr. Murphy, you mentioned that you do anticipate vaccine rates really picking up in the United States. What is the situation in European countries, and why is the situation a little more complicated there?
Well, it's really a disaster there. They are very bureaucratic. They try to act as one, but it's really all these different countries. And they were late to the vaccine purchase game. And now they're paying for it. They had the biggest bet they had was the AstraZeneca vaccine, and there's been all this trouble with the AstraZeneca. So they gambled on that one, and that one is problematic. So now the vaccine production is going to ramp up wildly in the next couple months. And so they're going to play catch up, but they may miss the summer.
Interesting. Well, a lot to keep in mind, and our thanks to Dr. Robert Murphy, Claire Bushy, and John Canena. Thanks so much for joining us.
Thank you.
Thank you.